Medical terminology in the cardiovascular system. There are three components of the cardiovascular system: heart, blood vessels, and blood. We already have given the different combining forms of these three organs. As a reminder, heart is cardi, blood vessels would be angio or angi, and then blood is hemat, or emia. But let's go over each of this. So our first word root here or combining form is hemo or hemato. And here are our examples: hemorrhage, rage or ragic means excessive flow or bursting forth. You could see an image here of a hemorrhagic stroke because the blood vessel has burst. And then another one is hematologist. We already know that very well. Anemia, we've used that many times. An is a prefix that means lack of or without. So there you go, the components with their combining forms. Next, we have blood vessels. The combining forms are angio or vasculo. Examples: angioma, tumor of vessel. If you want to be more specific, then you say hemangioma, tumor of blood vessels. Next, we have the veins. We have veno and phlebo. So if we add the suffix tomi, we make phlebotomy, and tomi means cut or to make an incision, to cut into the vein. But really, that is drawing blood from a vein. So this is a picture of someone doing phlebotomy. Maybe he is a phlebotomist, one who practices drawing of blood from a vein. And then we have arteries. Arteries, combining form is arterio, and we have an easy example there: arterial. The suffix al means pertaining to. Okay, next is the main organ in this chapter, which is the heart. The combining form is cardio, the word root is cardi, and let's do a few examples here. Cardiomegaly. If you recall, megaly is a suffix that means enlargement. So cardiomegaly is enlargement of the heart. And then let's do pericardium. So this time we're adding the prefix peri. So peri is a prefix that means around or surrounding. So pericardium is around or surrounding the heart. Is simply a suffix that means nothing. It's a noun ending. It's a part of speech. By the way, let's not take things literally in medical term. Pericardium, we don't really say it's around the heart. The pericardium is actually a double-walled membrane that surrounds the heart. That's the real definition of the word. And let's do another example. This time it's another compound word because it has two word roots: myo and cardi. Again, myo is not a prefix, even if it's found at the beginning of the word. It's another word root, which means muscle. And then we have heart, and then we have again that which is a noun ending. So myocardium is the muscle of the heart, or the muscle layer of the heart. Let's look at the different layers of the heart. This is also a good way to review our prefixes. So our myocardium is right there in the middle, right here. But before that, let's look at the inner lining of the heart, and that is your endocardium. The prefix endo right there means inside. So endocardium is the inner lining of the heart. And then once again, you have your myocardium right there, which is the heart muscle. And then we have the epicardium. Epi is a prefix which means upon or on top of. The epicardium is a layer, is the outermost layer or wall of the heart. And then let's also add pericardium here once again, which we gave as an example earlier. So pericardium is this double-walled sac that holds the heart. So remember your prefixes in this slide. We have endo, we have myo, we have epi, and peri. So here's another example with the prefix peri, the word root cardi, the combining vowel O, and then we have a new suffix, and that is synthesis. So synthesis is a suffix that means to puncture so that we can aspirate fluid. The image you see here, there's a needle that's puncturing through the chest into the pericardial sac. So that red space around the heart is your pericardium. And we puncture right there so that we can aspirate fluid, which is shown in the next picture here. And this is, look at this. This is the amount of fluid that has been aspirated from this baby's pericardium. So on our next slide, we're going to look at the different parts of the heart. This is where basic anatomy comes into place. The heart is a hollow organ that is made up of, that is divided into four chambers. The upper chambers are called the atrium, atria plural. So you have the right, but you also have the left. And then you have the inferior or the lower chambers are your ventricles. So you also you have the right atrium and the left atrium, and then you have the right ventricle and then the left ventricle. Our next parts of the heart, we're going to label the great vessels, beginning with the superior vena cava, superior because it's on top, and then you have inferior vena cava at the bottom, inferior. On the other side of the heart, on the left side of the heart, you could see what's labeled there would be your pulmonary vessels, the artery and the vein. Let's review that combining form or that word root pulmon. Pulmon is a word root that means or that pertains to the lungs. And finally, we have the aorta. The aorta is the largest vessel that comes out of the left ventricle. The aorta extends all the way down to the abdomen as it gives us so many branches to supply the body of oxygenated blood or blood high in oxygen. Here's an image that shows you the aorta. As you can see here, it leaves the heart and then it goes all the way down to the pelvic area. So to show you, the name of the aorta changes depending on where it's located. So for example, we have here abdominal aorta, okay? Because it's the aorta in the location of the abdomen. Let's move on and look at the, so let's do the next part. Let's label the next parts of the heart, and that would be these structures right there. Those are valves or gates that open and close, making sure the flow of blood is one way. The combining form for valve is valvulo, and an example of a word that has valvulo is valvular, valvular stenosis. The suffix ar is, again, it's just a part of speech. It means pertaining to, no special meaning. And then we have the second word, stenosis, which can also be used as a suffix. Stenosis means narrowing. So imagine if the doors in the heart are narrowed, it will be very difficult for blood to flow. This image right here also names the different valves of the heart. You can see aortic, pulmonary, bicuspid, and tricuspid. Let's do a quick review of a couple more prefixes, like the prefix tri, which means 3, it's a number, and the prefix bi means 2. Two cusp, or it's made up of 2 leaflets, the valve that is. So as a summary, these are the different structures that make up the heart. We started off with pericardium, and then we have the walls, the epi, myo, endo, cardium, and then the chambers, atrium for the upper chambers, atria if you want to make it plural, and then you have the ventricles, and then we have the structure that separates the right and left atrium. That means it's in between. The prefix inter means in between. That's the interatrial septum. The word septum is a structure that divides something right down the middle. If we have an interatrial septum, we also have an interventricular septum. So the interventricular septum is that structure in between the right and left ventricles. Septum. Okay. Um, if you've ever heard of a congenital condition known as ventricular septal defect, that means this septum is not intact. This VSD, ventricular septal defect, is also known as a hole in the heart. So maybe you've heard of people born with holes in their heart. That is the medical term for it, ventricular septal defect. And then we have the vessels. The vessels, you have your superior vena cava again, the inferior vena cava, some say vena cava, and then we have your pulmonary arteries and veins, and of course the aorta. And finally, the four valves, which we labeled earlier. So what you can do with this list is practice. Separate the word parts, the prefix if there is a prefix, the word root or word roots if there's more than one, and then you have the suffix, which is always found at the end of the word. So practice doing that. For example, we have here pericardium. So I did the first one. I put a forward slash mark after peri, and then another one just before And then let's do another one right here, pulmonary. And then down below you have your interatrial, separating the inter, the atri from the out. Okay, so practice doing your word dissection or word building. Okay. So this is an image, I've been talking about that hole in the heart or the interventricular septum. This is an image that shows you the interventricular septum down and the interatrial septum there on top. Okay. Next is the condition known as arteriosclerosis. The word root there is artery or pertaining to artery. And then the suffix sclerosis means abnormal thickening or hardening, as you can see in this image. The thickening or the hardening is commonly caused by a buildup of an atheroma, which is a fatty plaque. Now there's another medical term. We know that oma means tumor, and ather is the one that means a fatty plaque. It's not really a tumor of fat. It's a collection of fatty deposits in the arteries. So arteriosclerosis is a progressive and degenerative disease of the arteries. This is the one that can cause traffic or blockage of blood flow. So arteriosclerosis is a cause of coronary artery disease. The word coronary pertains to a crown because this network of arteries in the heart appears as if they encircle the heart in the manner of a crown. Crown is corona. So these are your coronary arteries of the heart. You see here a normal artery which will have very good blood flow, and then we have here a blocked artery. So this is what we call as coronary artery disease. CAD or coronary artery disease can cause myocardial infarction, also known as a heart attack. So if we dissect that medical term, myo is the combining form, which means muscle, cardi is heart, and al is a noun ending or an adjective ending. And the word infarction means death or necrosis, tissue death because of lack of blood supply. So as you can see in this image right here, this shows you the infarct or the dead tissue which is found in the front of the heart. Okay. Next is the phrase coronary artery bypass graft or CABG. which is one of the ultimate treatment for someone who has coronary artery disease because of a heart attack. So what they do is they bypass they bypass the site of traffic or the site of blockage, which is right here. Okay? And what they do is they harvest another vessel from the body. Usually, this is the saphenous vein, which is found in the thigh. We harvest that vein, and then we make it our new coronary artery, basically. So we connect those grafts directly from the aorta or from another artery coming off the aorta, and then bypass the blockage so that we restore blood flow to that part of the heart. Speaking of heart attack, the most one of the most common manifestations of a heart attack is chest pain, and there is a medical term for that. It's called angina pectoris. So pectoris means chest, and angina is pain, chest pain to be specific. Our next word is thrombus. The combining form is thrombo, and thrombus pertains to a blood clot. Um, we don't want any blood clots in our blood vessels. The first image right here shows you a normal blood flow. Everything is going on smooth. And then the second image is a blood clot right there, which slows down blood flow. The problem is when that blood clot comes off or detaches from the wall of the blood vessel, it becomes what we call as an embolus. So embolus, the combining vowel is embolo. That is a clot or other objects that's carried into the bloodstream. And the problem with that is that embolus can lodge to a smaller blood vessel and can completely block the flow of blood. So right here is another image showing you a blood clot versus an embolus. Thrombosis is the condition of having clots, and embolism is the condition of having an embolus. So we have two suffixes right there, osis, and we gave that before. We said osis means condition of, and so is ism. Sometimes we just choose one over the other. There's no special reason for it. Our next medical term is endarterectomy. That's a big word, but let's dissect it. End or endo, for some reason we have to drop the O there, means inside. Okay. Arter pertains to artery, and ectomy is a suffix that means surgical removal of or excision of. So I have a picture to explain what an endarterectomy is. So basically, they open up an artery and they remove what is inside, endo, what is inside of the artery, which happens to be another fatty plaque. Our next image here is an aneurysm, which is an abnormal dilatation and thinning of a vessel wall. So you could see this vessel is normal right here. It is smooth. It offers smooth blood flow. The vessel at the bottom is dilated. It's ballooning, and that's dangerous because that can easily rupture. Okay, this is specifically found in the abdominal aorta. So this whole thing is known as abdominal aortic aneurysm, also known as AAA, abdominal aortic aneurysm. So aneurysms can happen anywhere. In fact, one of the most common sites of aneurysm is actually the brain. And when that aneurysm ruptures, guess what? A few slides ago, we just talked about it. There's hemorrhagic stroke. And there's your aneurysm right there. Okay. Our next term is something that many of you are probably familiar of, electrocardiogram, also known as EKG. I know you think it should have been a K, right? It should have been a C, not a K. Well, we attribute that K to the Dutch spelling or German spelling of cardio. The German spelling of cardio starts with a K, and they happen to develop, or they have invented the machine, the first machine that was able to measure the electrical activity of the heart. So let's dissect that term. Electro is the combining form, cardio is another combining form, and then graphy is the suffix, which means, let's see if we remember that, a procedure of recording or taking a picture of. So electrocardiography, we don't just say electricity, heart, picture. That's not how we defined it. To make it to give it more sense, electrocardiography is a procedure that takes a picture of the electrical activity of the heart. Other associated suffixes with graphy are graph and gram. Graph and gram are the actual pictures or recordings that come out of the procedure. So if you're looking at a paper or an x-ray film or any other film, the actual picture is graph or gram. Okay? It's like photography is the process, photograph is the photo itself. If we have electrocardiography, we also have echocardiography. So echocardiography is a picture or a recording of the heart, but this time instead of electricity, we use sound, ultrasound. After all, the combining form echo means sound. Next, we have terms that describe heart rate. So the normal heart rate is about 60 to 100 beats per minute, and that is for adults. It's showing you here an EKG of a normal heart rate. And then we have tachycardia. The prefix tachy is means fast, so a fast heart rate over 100 beats per minute, lub dub, lub dub, lub dub, And then we have a slow heartbeat. The prefix is Brady. Okay, lub dub, lub dub, lub dub, slow heart rate. And then we have irregular heart rate. An irregular heart rate is arrhythmia. So if you look at that term, rhythm is rhythmia, and you add a prefix a, or in this case ar, which means lack of. So no rhythm, irregular rhythm. Next we have blood pressure. So a short exercise. Break down these terms using your / marks. Separate the different word parts and give their meanings. Hypertension, hypotension, sphygmomanometer, oximeter, hypoxia, and ventricular septal defect, or VSD. And then look up their meanings. Finally, I have here a clinical scenario, and I would like for you to translate these sentences to a lay person or a non-medical person, and might as well practice your pronunciations. So answers will be provided in the same module as usual.